Hello, everyone, and welcome. My name is Mike Hamilton. I'm Medical Director at ISMP Canada, and we really appreciate having you for the World Patient Safety Day edition of the Med Safety Exchange. Today is indeed World Patient Safety Day, and there are a lot of things happening. We know that there are really great webinars being put on by other organizations throughout the day, and presentations and events associated with the day, and even there's a lot going on right now. So we're really pleased that you have chosen to spend some time with us today. We encourage you to look for recordings of other World Patient Safety Day events and webinars in the coming days. And as we settle in, I'll ask our Faculty of Education student, Larian, to perform the land acknowledgement.
Thank you. We begin with a land acknowledgement for our office in Toronto, and I encourage you to reflect upon where you work and reside. We acknowledge we are hosted on the lands of the Mississaugas of the Anishinaabe, the Haudenosaunee Confederacy, and the Wendat. We also recognize the enduring presence of all First Nations, Métis, and Inuit peoples. We are grateful to live, work, and play on this land, and we want to contribute to the implementation of the Truth and Reconciliation Commission's 8 health-related calls to action. This webinar is a production of ISMP Canada and the Canadian Medication, Incident Reporting and Prevention System, CMIRPS, with contributions from all of our partners in medication safety and you, the audience. The Med Safety Exchange is presented on the Zoom webinar platform. Audience members are automatically muted and your video is disabled. The presentation part of this webinar is being recorded and will be available on our website in about 2 weeks or so. There are a few ways to make comments or to submit questions. Find the Zoom toolbar, typically at the bottom of your screen. The chat panel is open for broadcast, so feel free to introduce yourself and tell us where you're from. You can also make comments and ask questions via chat. All chat entries will be visible to the audience. If you select the Q&A tool, a window will open up, and you have the option to submit anonymously if you wish by checking off the lower box. Responses will appear in the Q&A panel, and questions will only appear in the panel once they are answered. We'll try to get to as many questions as we can, and there will be an evaluation poll at the end of the session, and we encourage you to provide feedback.
So thank you, Larian. We have a terrific webinar planned today, and we'll begin by an introduction to some of the goals, the objectives of World Patient Safety Day, some of the issues in medication safety that make this population so vulnerable, and an overview of some of the resources available from the WHO that you all have access to. And we often think of medications in the context of intentional treatment of some illness or some condition, but inadvertent exposure is a very significant source of medication harm to children. And we are very fortunate today to have a representative from Parachute to discuss that with us. And we'll follow that with Canada's drug agency, ISMP Canada, and dprescribing.org's introduction to the 5 questions to ask about my multiple medications. It's a resource for all ages. And our last segment will highlight a series of patient safety books for children, one of the many resources available that can help empower and engage families, caregivers, and patients of all ages. And if time permits, we'll conclude with a short Q&A session. So today, as noted, is World Patient Safety Day 2025. And the WHO puts this on to help raise public awareness, foster collaboration between stakeholders, and mobilize global action to improve patient safety. This year, the theme is Safe Care for Every Newborn and Every Child, with the slogan, Patient Safety right from the start. And this recognizes the vulnerability of this age group to the risks and harms caused by unsafe care. The WHO calls for action to eliminate avoidable harm in pediatric and newborn care, and really it builds upon the efforts of previous World Patient Safety Days related to safe childbirth, health worker safety, medication safety in general, patient and family engagement, and diagnostic safety. This year, we aim to drive meaningful improvement and reaffirm every child's right to safe and quality care. And although the data is imperfect, the WHO states that across the globe, incidents related to interventional procedures such as surgery are the #1 cause of healthcare-related harm in children. And this is followed very closely by the #2 contributor, which is medications. And we'll touch upon other aspects of pediatric healthcare safety, but we'll focus on harm related to medications. The goals of this year's World Patient Safety Day are to engage children and families, enhance medication safety in that population, improve diagnostic safety, prevent healthcare-associated infections, and reduce the risk in particular for small and sick newborns. The objectives are to raise global awareness in all healthcare settings and emphasizing specific needs of children, families, and caregivers. Mobilize governments, organizations, and society to implement sustainable strategies for safer care for newborns and children as part of your broader safety and quality improvement initiatives. Certainly to empower parents, caregivers, children, and patient safety by promoting education, awareness, and active participation in care, and to advocate for strengthening research on patient safety in the younger population. Now, any medication error that can happen to an adult can also happen in a neonate, in a child, in an adolescent. But there's always additional complexity and vulnerability through a number of very particular issues. One is just the rapid development and growth. There is a big difference between a preterm neonate, a 6-month-old, a 1-year-old, and a 16-year-old. There are medication supply issues, particularly with age-appropriate formulations and concentrations. There are monitoring issues. A number of the ways we monitor the effect of medications, whether it's through vital signs or even just simple communication, are challenging in the smaller population. There's a lack of research directly applicable to this group. Most of the research we do on medications, in fact, most of the research we do on patient safety tends towards the adult population. And we have to ask, is this all applicable to the younger groups? We often have a lack of expertise and experience with sick neonates, with sick adolescents. And this is particularly challenging in rural or remote areas where you just may not see too many children. And this leads to a number of transitions of care and transportation issues as we escalate care. There are a number of more people involved, and this, of course, introduces that type of vulnerability to this population. So medication use in children presents unique challenges, and each step of the medication use process carries specific risks. The likelihood of error increases in children because the dose is often based on the age and weight, surface area, so you need to do individual calculations almost every time you administer medications. And even small dosing errors can pose significant risk when compared with adults. And again, this is further heightened by the use of medications that are designed for older populations, for adults, but we use them in children. So they may be used off-label, or they may be used outside of age-related indications. And another challenge is the need to manipulate these medications. And that introduces additional risks such as stability, bioavailability, and dosing accuracy. And recognizing that there are some similarities in medication safety, but there are a lot of differences, the WHO created some key messages. And number one is children aren't small adults. They require individualized care that fits them, their age, their weight, their developmental status, their physiologic ability, medical needs, their ability to communicate, and their specific context in which they receive care. Number two is safety first, always and in every healthcare setting. Children are more at risk in intensive care and during complex treatments. and protecting them from care must be paramount. The third one is the most common causes of harm are known. We know that this includes medications, this includes diagnosis, infections caught during care, problems with medical equipment such as tubes and monitoring, and missed warning signs when children's condition starts to get worse. It's often not as evident as it is in an adult who can communicate. And lastly, safer care depends on safe systems and teamwork. We know this from our continuous work in medication safety, and we know the well-designed systems, supported staff, engaged caregivers keep children safe, and we should listen to every voice on the team. But there are things that we can do to enhance care. And these, the WHO has organized systematically by people, tasks, tools, environment, and organization. Under the people heading, there are items such as improving medication literacy, providing clear instructions and demonstrations in culturally sensitive materials. Under task, we hear of incorporating double checks to high-risk medicines, strengthening medication review and reconciliation. And under tools and technology, think about things like standardizing drug concentrations and dilution processes, implement electronic prescribing with clinical support where able, and introduce checking processes in software development. And the working environment can be also made much more conducive to safety by minimizing interruptions, providing staff with the assistance that they need, and organization role in ensuring safety through a safety culture. And altogether, we work towards improved care for newborns, children, and adolescent care. And that's reflected in these tips for all of us. All of these are available on the WHO World Patient Safety Day campaign website. And finally, there are calls to action. There are ways to participate, no matter what our role is or what our many role is, as a parent, as a practitioner, as a policymaker. So be your child safety champion if you're a parent or caregiver. Health practitioners should commit to delivering care that's safe and child-centered. Policymakers and healthcare leaders need to invest the resources needed for safe care for children. And our society in general needs to raise awareness. We need to mobilize communities. In particular, we need to demand that every child can receive safe care. And every child has that right to safe care. From the very beginning, newborns, young children face higher risk due to their rapid development. They have evolving health needs. They have different disease patterns, and they rely on us as adults and as practitioners to speak up and make decisions for them. And they face added challenges in some cases due to socioeconomic circumstances. And this makes them far more susceptible to harm if care isn't specifically adapted to their age or their size or their health conditions and the context. And that's why World Patient Safety Day 2025 is dedicated to highlighting the need to unite all of us in action to prevent avoidable harm in pediatric care and to build a safe, healthier future for every child. So medication safety includes addressing inadvertent exposure to pharmacologics, whether it's accidentally substituting one drug for another for a patient or administering a treatment to the wrong patient. But it also includes, very importantly, unintentional exposures of medications to children. And we're very pleased to have a representative from Parachute here to tell us more about the organization and more about pediatric poisonings.
Wonderful. Thank you, Dr. Hamilton. And I'm so pleased to be here with all of you today and to be part of this collaboration with our partners at ISMP Canada. So for starters, I'll tell you a little bit more about our organization called Parachute. And we are Canada's national charity dedicated to preventing serious and fatal injuries. Our organization focuses on unintentional injuries, And we focus on all ages across the lifespan, driven by what the data and research tell us about how people in Canada are harmed and who is getting harmed. Within the broad scope of unintentional injury, we have 4 priority areas. These include falls, motor vehicle collisions, poisonings, and concussion. And of course, today I'm going to be focusing in on poisoning and why is this one of the priority areas that we have at our organization. Every 5 years or so, Parachute publishes our report, The Cost of Injury in Canada. And we look at the human, societal, and economic costs of various causes of injuries. And you'll see here from our report data that when we look at unintentional poisoning, it is a leading cause of death, hospitalization, and emergency department use in our country. As of 2018, we saw a rise in unintentional poisoning deaths, and this is attributable to the toxic drug crisis. Now, when we focus on pediatric poisonings, the good news is that fatalities are rare. However, looking at other healthcare utilization, so admissions to hospital and particularly emergency department visits, the burden is still quite high for children. And economically in Canada, this is in 2018 Canadian dollars, poisonings cost $2.6 billion to the Canadian economy in a single year. And for the pediatric age group alone, looking at up to age 19 years, that annual cost is $134 million. And if we keep in mind that we are talking here about acute incidents and quite preventable injuries, when we think about the human burden and the potential cost savings, reallocation of spending and resources within our healthcare system, prevention does need to be a significant priority. And what I want to share with you today is information from a data source that you may not be familiar with, which is our poison centers in Canada. You may be aware of the hospital administrative data sets, so that hospitalization and emergency department visit figures that I showed, or fatality data that come from our vital statistics database. But we also have the advantage, the benefit of another form of health data that gives us rich information, and this is our poison center data. Poison centers are key points of contact for both the general public and health professionals seeking medical advice related to poisoning. In Canada, we have 5 provincially and territorially funded poison centers, and you can see in this map depiction that those poison centers have regional coverage within the country. These services operate 24/7. They are phone-based, they are no cost to the public or health professionals, and they're anonymous. Poison centers are staffed with medical toxicologists, registered nurses, and/or pharmacists who have been certified by America's Poison Centers as specialists in poison information. Now, why is this service so important? And in terms of contributing to our healthcare system, for health professionals, accessing poison center expertise may reduce unnecessary testing or interventions, and in other ways, guide best practice care. Roughly 60% of cases managed by poison centers are managed with the person remaining in their home with expert guidance from poison center staff. And so this is beneficial for the public to have access to the service without requiring seeking medical care, for example, in an emergency department. It's also helpful for our system to divert unnecessary emergency department visits. But what I'm also going to talk about today is the fact that these poison center data give us information about incidents that don't make it up to the hospital system, which is quite unique. It also gives us a little bit more context on incidents, which is critically important for prevention practice. A quick overview of how Poison Center data are collected. It's collected over the phone by the caller by a specialist in poison information at the Poison Center, and they enter the data into a case management system. The data are then coded according to National Poison Data System coding guidelines that have been published by America's Poison Centers. And so the circumstantial information that is collected around these incidents gives us rich information to support prevention and also to potentially inform regulatory response. And we know that population level regulatory and policy response are the most impactful ways that we can make change at the population level. So an example of information that we find in Poison Center data we don't get elsewhere are categories and product types of the substances involved in an exposure. Poison Center data also tend to be more current than other databases, so really interesting for understanding emergency trends and early warning signals that we should be aware of for our prevention practice. Now, here's a breakdown of from 2021. This is consistent in more recent years of exposure calls made to poison centers in Canada. And what you'll see here is almost half of them are pediatric cases. Now, a caveat here that this is not population level data. What I mean by that is calling a poison center is voluntary. There's no mandatory reporting of poisoning incidents to poison centers. And it also relies on people being aware that they can call the poison center and how to reach them. So it's not population level, but as I said, it's rich in detail. And for our purposes today, you can see that it gives us that rich information specifically about the pediatric population. And I also want to draw your attention that about a third of the calls specifically are in very young children under 6 years. When we look at what calls are coming from the community and from health professionals to poison centers, we can see that analgesics or pain medications are actually across all poison center calls, it's the leading substance involved. And you'll see on the screen that this is true for the pediatric population as well. Because of child development, Dr. Hamilton referred to some of these things, it is important that we break apart the pediatric age group. So if you look on the one side to younger children and preteens, in addition to medication, what you'll see are just very common products that are found around the house, including analgesics, right? The presence of acetaminophen and ibuprofen in households is common, but you'll see other things, household cleaning substances, potentially toxic plants. As we get into the older adolescent age groups, you'll see actually that 4 out of the top 5 substances are all in the drug categories. And we can break down the drug categories further to take the other types of substances out of the mix, because I know that we're particularly interested in medication safety today. So again, for younger children, when we break the drug exposure substances further, we're still seeing things that are very common in the average household. So again, acetaminophen and ibuprofen in particular being really common analgesics, but we're also seeing vitamins and supplements, natural health products, things that the public may not consider as risky or a potential hazard because they seem more natural in nature, or because they don't require a prescription, may not come in a child-resistant package. So important for parents and anyone giving care in the home to be aware that most products, once they reach a certain dosage, can potentially be toxic, particularly for children and their little bodies, their little systems. As younger people age, then they may be accessing substances both inside and outside the home. There may be decreasing supervision of use of medications, including over-the-counter medications. There may also be changes in the intent of use with products. So for example, the Ontario Student Drug Use Survey found increasing rates of misuse, intentional misuse really, of cough and cold medicines by 11 and 12-year-olds. So you'll see, that contributes contributes to things like the antihistamines and, of course, analgesics commonly included in those types of substances. So what's the first lesson I want to share with you based on this information I've presented? The first lesson I want you to take away today is knowing that poison centers are an important resource for health professionals and your patients both to be aware of. So in terms of health professionals, poison centers provide toxicological expertise to improve care and resource management within healthcare settings. Poison centers provide a free service to the public in cases of potential poisoning. And poison centers provide pan-Canadian and regional data on events that may result in no effects or minor effects. And these are important for early signal detection earlier than when we start to see the results in our hospital data. So that's a bit of a snapshot of what we're aware of broadly around pediatric poisoning and specifically medications. What about when it comes to prevention? And so in order to understand prevention, we look to evidence on what is effective and what works. And there's an important piece here around language when it comes to pediatric medication safety and pediatric poisoning prevention. And a word that we want to avoid using is referring to anything as child-proof. There really is no such thing. So when it comes to prevention, we need to consider layers of protection best to prevent poisonings. And, this is a bit of an analogy to the layers of protection you have in the healthcare system, quality control, and things you have in place to safeguard should a potential error be made. It's no different when we're talking about safeguarding our homes. And really the elements, those layers of protection when we're talking about children unintentionally accessing medications or other poisons include, first and foremost, active supervision, keeping eyes on children, especially younger children, at all times. Safe storage, and being very specific about what safe storage is. So this means putting medications, including over-the-counter medications, out of reach, out of sight, and locked up. These within themselves are layers of protection within safe storage. It's incredible what young children can do to access things. Before they can walk, they can climb. And so if a child sees something, they will go to reach for it. So out of sight as well as out of reach, and locked up if possible. The other layer is child-resistant packaging, and not only purchasing items in child-resistant packaging, but keeping them and putting them away and sealing the lid each time. So how do these create layers? If for a moment I am distracted or my attention is diverted, perhaps beyond my control, and my child is trying to get into something, having it safely stored will buy time until they can get into it. Should your child climb and get into that shelf where this is sitting, the child-resistant packaging buys more time, again, for an adult to enter the picture and remove that substance from the child's grasp. So these are all layers. Eventually, and this is demonstrated in the testing of child-resistant packaging, a child will get in there eventually. So these layers of control are really important. And the nice thing about this is we can give really clear guidance on exactly what these things mean. Something else we can do to prevent when we think about secondary prevention, so say a child has accessed medication, or as a parent, there was a communication mix-up and the child was given a couple of doses, we can prevent secondary harm by acting in the moment. And one of these things can be improving awareness of access of poison center services, which is an immediate phone call, not needing to necessarily go to emergency unless the poison center directs you there. Saves time, and this is way better than Googling. That's also one of the messages. Call the poison center right away. We did a couple of studies around Canadian adult awareness of poison center services, and it's quite low. It's a little higher among parents, which is a good thing, closer to maybe about 30%. But in terms of adult awareness of their local poison resources, only 18% of Canadian adults are aware. So we do want to increase knowledge that there is this amazing service available to the public. And in 2023, a great success was that a 1844 toll-free number was launched across most of Canada to simplify access to poison centers. And this is something Parachute and our partners had called for about 20 years, to have access to a central number in Canada. And finally, I want to reemphasize the importance of reporting, not only for immediate potential intervention where regulators can act on this information, but all of this information feeds into prevention efforts and how we can understand what's happening in the system. So ISMP Canada reporting systems are available, and also through Health Canada, we can do broader reporting of substances beyond medications. So the second lesson I want to leave you with is that if you are a health professional or working within the health system, you are a trusted intermediary for the public, and you can contribute to prevention. One of the key ways is through anticipatory guidance on safe storage and safe medication use in the home. Again, those really simple safe storage messages where we don't just say safe storage, but describe exactly what it is, then that is helpful. We did a project where we talked to parents about cannabis edibles, surveyed parents about cannabis edibles. And if we just ask, do you store this safely? Most parents believe they are and are doing their best. However, when we ask more specifically about, do you put this out of reach, out of sight, and locked away, those numbers drop. So let's be specific about what safe storage and safe use look like. You can also help us increase patient awareness of poison centers. And the great thing about poison centers, I've been singing their praises, but parents can call in times of uncertainty. They don't have to be sure. If they're in doubt, if they think their child they thought they dropped a pill on the floor and now it's gone and it's likely in their child's mouth. If they're just concerned, they can call. They don't have to be sure. And it may be more inviting to call versus have to get in the car or public transit or call a taxi and get themselves to in-person healthcare service. Again, if healthcare follow-up is required, the Poison Center will direct them to that care. The other thing I do want to mention, we're talking about unintentional poisoning today, but in cases of suspected self-harm using medications or other substances, there are many services available and of course lines to use in a crisis. But again, if someone's unsure, if someone has a doubt, a poison center is another place that can be a point to call for trusted information. And I just wanted to leave you with a place to go for more information. At Parachute, we have a poison prevention collection for professionals with various information. You can find that on parachute.ca in our professional resources section. And we also encourage you to visit infopoison.ca. That's the site for the Canadian Association for Poison Centers and Clinical Toxicology. And there you can find information about your regional poison center if you're interested in connecting with them as a health professional or connecting your patients to them. Thank you very much for your attention today. Appreciate it.
And thank you so much. Really appreciate Parachute highlighting all of these great sort of proactive counseling that we can do as practitioners when we're prescribing, when we're dispensing to patients who have children. And a really good reminder that poison centers are available to parents. They're also available to practitioners as well if you have concerns about maybe what a patient or a family member has brought to you. So really, really appreciate it. Thank you so much. And polypharmacy is increasing globally due to the age populations and increases in chronic conditions. And we often think of this as just an issue in the elderly, and it is. But the expanded availability of treatments for chronic pediatric illnesses is also introducing the burden of polypharmacy to children. There are many multiple therapies that certain children must take. So regardless of the age group, there are opportunities to evaluate polypharmacy and to equip patients and caregivers with tools to participate in the assessment of multiple medications. So I'll turn it over to the great team at Canada's Drug Agency, ISMP Canada, and deprescribing.org to tell us of a new tool.
Oh, thank you very much, Mike. Did you know that 3 out of 5 Canadians over the age of 65 take at least 5 different prescription medications? This is also called polypharmacy. Hi, everyone, and happy World Patient Safety Day. My name is Alice, and I'm a hospital pharmacist and a senior medication safety specialist at ISMP Canada. I am pleased to walk you through this exciting new tool for patients and caregivers called the 5 Questions to Ask About My Multiple Medications. It is designed to help patients and caregivers reflect upon and talk to their healthcare provider about their multiple medications. Presenting with me today is Jonathan Lamb, Director of Appropriate Use at Canada's Drug Agency, and he will be giving you the background now of how this all started. Over to you, John.
Thank you so much, Alice, and thank you for having me again at the Med Safety Exchange today. I presented an opportunity I think in some spring about this, so excited really today to have ISMP Canada share the 5 questions to ask about my multiplications today. So just a quick reminder, Canada's Drug Agency is an independent, not-for-profit organization. And we provide evidence and advice to health system leaders to help make informed decisions. So we answer questions about how effective is a new drug compared to other treatments and which patients would benefit most from a particular treatment. As part of our work, we also support patients, caregivers, prescribers, and policymakers in improving the appropriate use of medications across Canada. So here are our goals in terms of appropriate use. So really kind of want to highlight that our aim is to work collaboratively in providing, again, patients, the public, caregivers with tools to help them make informed decisions and equip clinicians with evidence-informed tools as well, and really all the while working with partners. Next slide. Thank you, Alice. And I think both Dr. Hamilton and Alice really set up why policy pharmacy is important. While there is a focus on seniors, this is equally applicable to children as well. So on this, really kind of want to highlight, this is a collaborative effort between ISMP Canada and deprescribe.org to develop 2 sets of tools. One for patients, the 5 questions that Alice will be highlighting, and also for prescribers, the 5 tips we're actually looking to finalize. So very great collaborative effort that we're having. And with that, I'll pass it to Alice to talk through the really fun parts of the project.
Oh, well, thank you very much, John. To develop this resource, we used a robust methodology, starting with an extensive literature search and synthesis to learn about the current evidence to support increasing awareness of polypharmacy, patients' preferences and perceptions, and the tools that are currently available for patients taking multiple medications. Once we synthesized the thematic results of the research, we presented a summary to the patients and caregivers and other health system partners, including members of the Appropriate Use Coalition, in 3 roundtable discussions. We obtained and listened to their feedback, incorporated all of this, and developed the 5 questions tool and toolkit and finalized it based on more feedback. Let's see if I can get that. During our roundtables, we had incredible engagement of patients and caregivers through all the meetings, and especially when we asked them this question. When you think of multiple medications, what words come to mind? The word cloud shows some of the top words that patients and caregivers at our roundtable came up with, such as side effects, asking questions, it's complicated, interactions, it's expensive, overwhelming, time consuming, lack of education. Do these words resonate with you? So let me go through the questions one by one. What is the purpose of each of my medications? Could I be experiencing any side effects or drug interactions? As seen in the word cloud, this was a major concern amongst patients and important to talk about. Could lifestyle changes also improve my well-being? This question has to do with things that patients can also do to improve their health alongside their medications. As an example, keeping a sleep diary and setting an alarm for regular sleep time can help patients develop a better routine that can improve their sleep hygiene. This may be helpful to reduce or eliminate the need for a sleeping pill, which can increase an older person's risk for falls. The next question is, are all my medications needed? And lastly, what other information should I know about my medications? Building off the tremendous uptake of previous ISMP Canada patient resources, which encourage patients to ask questions, these 5 questions about my multiple medications can help patients reflect on and ask whether a medication is working well and what's not, and also to empower them to be a more active partner in making decisions about their medications. It's a launching point for further discussions. If you click on the link in the chat, it will bring you to a tool and the accompanying toolkit that you can scan the QR code to access. The accompanying toolkit provides patients with more information and risks of taking multiple medications. You'll also find a wonderful story about my friend Judith Maxwell, whose life was turned upside down by harmful side effects from multiple medications. In her words, she survived undiagnosed serious side effects to multiple medications. With her care team's help, she reduced the unnecessary medications and regained her vibrant life. Her story, shared with permission from her family, continues to inspire change, and you can read it in the toolkit. The toolkit also takes a deeper dive into each question and provides practical tips and additional resources. I would like to highlight one important tip today, and that is the reminder to keep an up-to-date medication list with you. My personal challenge for each of you today on World Patient Safety Day is to check that you and your loved ones have an up-to-date medication list that includes the reason why you are taking each medication. Keep this list with you at all times and share it with the important people in your life. Make sure you include prescriptions, vitamins, minerals, supplements that you take. Record the dose, the frequency, and the reason why you take it. I've worked as a pharmacist in an emergency department for over 20 years, and I have seen where not having the right medication information can cause harm. And in life-threatening situations, even seconds count. So having this list with you always can literally save your life. So we hope this topic of multiple medications has piqued your interest and that you can help us spread the word. If you're a healthcare provider, we encourage you to share this information with people who are taking multiple medications. And if you're a patient or a caregiver listening in, I encourage you to schedule an appointment to discuss your medications with your doctor, nurse practitioner, or pharmacist, and bring this list of questions with you along with your up-to-date medication list. Give one or all of these questions a try and tell us your experience using it and the toolkit. Take a photo of where you might be seeing these questions and send it to us or tag us on social media at ISMP Canada or at CDA-AMC. So the next time you sit down with a patient who takes multiple medications, or as a patient yourself with multiple medications with your own care team, remember to try these questions, as it might just help spark a really important conversation. So with that, I'll pass it over to you, Mike.
Thank you so much, Alice, for introducing the tool, and Jonathan as well, and the accompanying resources. And I want to highlight the applicability of these resources to pediatric populations by noting that a 2024 study from Italy highlighted that roughly half of children living with medical complexity did have a polypharmacy burden. And an earlier study from Ontario demonstrated that children with medical complexity took a median of 6 medications per day. So it is very important for all ages for us to think about this. And as we turn the page, we often struggle with how to communicate healthcare concepts to children. And I believe this is particularly challenging for issues such as participation, agency, things like empowerment in healthcare. These characteristics are fundamental for safe practice, but often we kind of dismiss children's ability to understand it. And, although due to conflicting schedules of other webinars and World Patient Safety Day, we're unable to have a representative from World Patients Alliance. We'll ask ISMP Canada's Senior Medication Safety Specialist, Ambika Sharma, to introduce a great set of materials. Ambika?
Thank you for the opportunity, Mike, and thank you to everyone tuning into today's Med Safety Exchange in recognition of World Patient Safety Day. So on behalf of the World Patients Alliance and the Elsevier Foundation, I'll share these creative and informative patient safety books for kids, which I'm excited to read with my own 5 and 2-year-olds. But first, I'll share a little bit of background. The World Patients Alliance provides a platform to empower and raise the patient's voice for the provision and access to safe, quality, and affordable healthcare. They work toward ensuring patients have an active role to play in all the stages of healthcare, which includes planning, provision, monitoring, research, and evaluation of health services. And they represent patients from all world regions. Elsevier is one of the world's largest academic and scientific publishers that provides information, analytics, and digital tools to researchers, healthcare professionals, and other institutions worldwide. The Elsevier Foundation works in partnership with science and health communities and takes an action-oriented and collaborative approach with the projects they support. So the World Patients Alliance collaborated with the Elsevier Foundation to create a series of children's books designed to raise awareness and educate children about patient safety. There are 5 books freely available online right now, and for anyone with or around children, you can recognize these very familiar questions and conversations in the titles. Some of the books have been translated in additional languages, and some are available in video or audio format. And this link will also be shared on the Med Safety Exchange website within the next week or so. This is a nice excerpt from one book, just to give you an idea of the content and graphics. And we ask you to please help your kids or any kids that you know join the Safety League with Dr. Safety by sharing these materials widely, the books, the audio, the videos. And parents and healthcare providers can also use ISMP Canada resources to support medication safety strategies with children, because early medication safety literacy will support ongoing learning and dialogue as they grow. And so there's the 5 questions to ask about my medicine on the left, and an example of a child-focused consumer newsletter on the right. Thank you, and back to you, Mike.
Thank you, Ambika. Very useful materials. It's really nice to have all these available as a collection. And as I think we're up against the clock at 12:55, so we won't have time for questions, sadly, but I know it's been a very engaging chat box, and a number of questions have been submitted. A reminder that we'll put all the links to the materials on our website afterwards in the coming days when we upload our recording, and we encourage you to go back over the recording and see former recordings. And we also encourage you to check out other organizations as well, as they presented on World Patient Safety Day. They have some really good materials out there on pediatric and newborn care. So thank you again to all our panelists. I want to thank them for their stories, for their expertise, for the work that they do in trying to provide us with tools, with perspectives, with ideas, and with challenges even to make care safer, particularly today on World Patient Safety Day, a very vulnerable population. And I want to encourage all of you in the audience to continue to highlight these risks. Please, and if you want to present, please let us know of your ideas, of your projects, because we learn from these stories. And we know that pediatric care is challenging, and there are issues that may not rise to organizations such as us, and we do want to know about them. So please, tell us your stories. We learn from conversations about you, about errors, about what's happening, and we are able to make a difference all together, all of us. So please share your experiences to make care safer. And again, please answer the poll. Please reflect on what you've heard, and please give us advice on what else you'd like to see and how we can do things better. And again, finally, the link to the recording of the webinar will be on the webpage in the coming days, probably within a week or so, along with as many links as we can to the materials. And remember that World Patient Safety Day extends 365 days until the next one. So please check out all the WHO materials. It's all widely available in many languages. It's all free. And we look forward to seeing you in the new year. Thanks again, everybody. Enjoy the rest of the day.